We are here today with Dr. John West from Breastlink Medical Group. Dr. West is our medical director of breast surgery, and we are here to talk about his brand new book that he just wrote. So Dr. West, please tell me what inspired you to write this book and what is it called?
Well, first of all, it's called Prevent, Survive, Thrive. It's every woman's guide to optimal breast care. So it's not an easy answer to what problem, because it didn't happen just overnight. It was kind of a process that convinced me more and more that something needed to be done. There's so many controversies, and women are so confused. Even the doctors are confused. The biggest one that comes out right now is this 40, not 50 argument. The government committee is telling women to start mammograms at age 50. We know starting at age 40 saves thousands of lives, and yet because of attempts for cost containment, if they shift it to 50, young women are going to die needlessly. We're making incredible progress in breast care. We now know that we can improve survival by identifying women with dense breasts and doing extra imaging and catching small cancers that we might have missed in the past. There's the issue of self-exam. There's the issue of the cell phones. There's a whole series of controversies. So that's kind of the big picture of, as the controversies got more and more intense, I got more and more convinced I needed to write a book. And then on the individual patient level, I see so many problems, the delayed diagnosis. The case that really stands out is Michele Watson, who the book is dedicated to. And she was 21 when she found a lump. The doctor says, oh, it's not in your family, you're too young, don't worry about it, it's just fibrocystic. And the lump continued to grow. 2 or 3 other doctors said the same thing. Finally, 2 years later, she's complaining of pain in her chest and her back. They get a bone scan. She's got metastatic disease. It came from this growing breast mass. And it turned out she lived for about 2 more years and died prematurely. It's just a tragedy. And the real tragedy is, and there's a lesson to be learned here, had the patient look at her doctor in the eye when she went in with her lump and said, look, I want to have a directed ultrasound. I'm only 21, so I won't get the mammogram unless you see something. They certainly would have seen it on the ultrasound. It had malignant characteristics. They could have done a needle core biopsy, probably saved her breast, put her on chemo, and she'd probably be alive today. And I see this tragedy of delayed detection, delayed diagnosis over and over. And it was that I wanted to write a book that where women would have a guideline how they could avoid any of these pitfalls for delayed diagnosis.
Right. So Dr. West, roughly in your career, how many surgeries have you performed?
Well, I've been doing this for a long time. I started my internship in 1967, and I've done anywhere from 5 to 25 surgeries a week since then. So I did the math the other night, and surprisingly enough, it came up to between over 15,000, somewhere between 15 and 20,000 cases. But that's a long career.
Wow, that's very impressive. So based on your years of experience, what would you say is the most important change in breast cancer care?
Oh my gosh, it's evolved from the turn of the century. We're doing radical mastectomies, and the first one of the early surgeries I saw in my internship was a 34-year-old lady that had bilateral mastectomies, and I had to go change the dressing the next morning, and I looked at those. The wounds were just awful. She was disfigured. That night I talked to my wife. I says, I love surgery, but I don't want to do any of that breast surgery when I get into practice. And it just had a very profound impact. But we went from having a woman with a breast lump sign a consent to have a mastectomy. We would do the surgery. They'd do a frozen section. If it was positive, they would remove the breast. If it was negative, she would just be a little bandage and go home in a few hours. We've gone from that point where we virtually diagnose all cancers with a needle biopsy prior to planning any kind of surgery. We've identified some women that benefit from chemotherapy up front, a very important new concept. We're now doing genetic analysis where we used to just look at high-risk women like Angelina Jolie. Now we're virtually testing everybody because it's so inexpensive to do testing now. And I think these changes have completely revolutionized how we take care of breast patients. And it's become such a specialty that oftentimes the primary care doctors that are ordering the test aren't familiar with all the progress. So the woman has to be empowered to know where to go to get this information.
Right, things have definitely changed.
Dramatically.
Yes. So what was the most difficult part of writing this book for you?
Well, the whole thing was kind of difficult in the way I have a full practice, and so I had many other things to do, but I've learned how to block out time, and I got used to it, and I really enjoyed writing it, but what we had were deadlines, and so to get the book out by the October Breast Cancer Awareness Month, I kept getting these deadlines, and my gosh, I would estimate how much time it would take on the weekend, and it invariably took twice as much time to get it done, but we worked out the details, we got it right, it was worth all the energy, and I'm very proud of what we've done.
That's wonderful. Now, one of the most important questions, will you write another book?
You know, I could. I'll keep an open mind to that. It depends on what the response is to this book. If I really feel there's a need and I feel that I have something to say, and the patients, the buyers of the book like the way I say it, because the book is written much differently. It's not an encyclopedia at all. It's really it's based on what I would tell my wife or daughter if they had what the reader would have had. So the patient, it's not meant to be balanced and saying, here's all your options. It's saying, here's what I would do for you. Here's what I tell my wife. Here's what I tell my daughter. And I think people probably will relate well to that, because the question I get after a long, detailed explanation of what needs to be done when you have cancer, what decision to make, the patients look me in the eye and say, Doc, just tell me what you would do if I were your wife. Tell me what you do if I was your daughter. And that's the way I like to practice. But the only way you can get those answers is a book that's written like this. The average book just gives you a balanced description, and sometimes they give you so much information, it's just confusing. So I like to get right down to the nitty-gritty.
Right, and patients really, truly appreciate
that
you tell them what you would tell your wife or your daughter.
Right.
So if you had one message to relay to your readers, what would that message be?
Well, I think women must be empowered. They must realize if they want optimal breast health, they have to know more than the average doctor. They have to know if they have a lump and the doctor says, oh, it's just fibrocystic, don't worry about it, or it doesn't run in your family. You got to say, look, this is a change in my breast. I want an ultrasound, I want a mammogram with focused views. If there's any abnormality, I want a core needle biopsy. If the workup is completely negative and you're sure it's okay, I want you to see me at 2, 4, and 6 months. And you know what? If you're not going to do that, I'll find another doctor, because that's what Dr. West says in his book, and that's what they tell us to do.
Well, that's very good information. So, Dr. West, we are very excited that you wrote this book. Everyone's excited. I can say I myself am, all of your patients, the organizations we work with. If anyone has any questions about where to purchase the book, they can go to breastcare.com. More information on Dr. John West, you can visit breastlink.com. Thank you, Dr. West. It was a pleasure to interview you today about your book, and we all look forward to it coming out.
Thank you.